Gastric bypass is a weight loss surgery which involves reducing the size of the stomach to promote early satiety and bypassing a section of the intestine to limit food absorption. This is usually carried out by the Roux-en-Y procedure, in which the stomach and intestine are reconnected by creating two new communications, or anastomosis.
One anastomosis gastric bypass is a modification of this procedure that simplifies the technique, reduces operating time, and minimizes complications.
Overview. Obesity can negatively affect your life and health in a multitude of ways. It is associated with coronary artery disease, high blood pressure, arthritis, diabetes, cancer, depression, sleep apnea, infertility, and other conditions. Weight loss through bariatric surgery considerably reduces the risk of disease and improves obesity-related health conditions, as well as other aspects of life. Indications.
As with any bariatric surgery, one anastomosis gastric bypass is indicated when obesity endangers your health and significant weight loss has not been achieved through diet and exercise.
Surgical procedure.
One anastomosis gastric bypass surgery is performed under general anesthesia.
The procedure may be performed by making an open incision or using a laparoscopic technique, which involves making 3 to 4 small incisions through which a camera and special narrow instruments are introduced. Your stomach is first stapled so that a pouch or sleeve is created that is separate from the rest of the stomach. In the Roux-en-Y procedure, the intestine is then divided after the initial segment, called the duodenum, and the lower cut end is anastomosed to the sleeve, while the upper end anastomosed to the intestine below the division.
With one anastomosis gastric bypass, the stomach sleeve is anastomosed to the intestine below the duodenum without making a complete division in the intestine.
This single anastomosis allows food that enters the small sleeve to bypass the rest of the stomach and duodenum and pass into the lower intestine. Post-operative care. Following the procedure, you will stay a day or two in the hospital and will be started on small amounts of clear fluids initially. Your anastomosis will be checked for any leakage. You will gradually be allowed to advance your diet and will be required to follow up with your doctor on a regular basis. A healthy change in lifestyle is recommended to obtain the best results. Risks and complications. The single anastomosis gastric bypass is generally a safe procedure, but potential risks include infection, bile reflux, leakage, nutritional deficiency.
One anastomosis gastric bypass is a modification of traditional weight loss surgery to simplify the procedure, reduce operating time, and lower complication rates while still ensuring good weight loss results.